Oh no, I didn't send it in time. Well, yeah, I also didn't want to waste the paper, but really I just didn't have it together in time to give it to her. So, oh, one of these rare moments in life where you try to look the part. I think so. As ready as I'm gonna be. Oh yeah, she texted me. She was like, "I'm sorry, I'm sick." hope so. We'll see if I live up to expectations.
Yeah, got the other one. You want to come up and make sure this is where you want it? You're just going to stay here,
Oh,
like in this spot here?
yeah, that's
Okay. All right. All right, guys, let's get going. We're going to introduce Dr. Johnny Lawrence here this morning. He was born and raised in York, Pennsylvania, attended Franklin and Marshall College in Lancaster, where he graduated cum laude with a Bachelor of Arts in Neuroscience. During college, he served as a Hackman Scholar, presented research on visual scanning patterns in drivers. And his senior project involved research studying the genetics of rare disorders in the Amish population in Lancaster, and he was published for his work. He graduated from Penn State Hershey College of Medicine in 2015 before coming to Louisville for his residency. He's going to be talking today about a subject that I, of course, have a great interest in. I think Dr. Lawrence has dug up some even more interesting stuff about this subject. So I hope you all will join me in welcoming him up here to tell us about loneliness.
Thanks, Dr. Goodwin. So today, I'm going to be talking about loneliness, something that's been a fascinating topic for me, born out of a lot of discussions that I've had with Dr. Goodwin during supervision and in classes. And what I want to talk about is the loneliness paradox, the epidemic of loneliness in our hyperconnected world. Hyperconnected being a new word that means that we're connected to everyone through our tablets, our computers, and can access people socially now through the internet. I have no financial disclosures. So the objectives, this is kind of the narrative that I'm trying to tell here. And so what I'm going to be doing, we're going to define the concept of loneliness and its relationship to social isolation and solitude. We will then look at the demographics of loneliness and its effects on life expectancy. Why does loneliness matter to us? And then explore the physiologic and psychological effects of loneliness. And then kind of one of the keys of this is to give you a framework from an evolutionary perspective of why loneliness exists for our survival. And that can be the framework that you can use as a tool for evaluating your patients in the future. And then within that framework, we're going to look specifically at social internet behavior and see if this framework predicts how lonely individuals behave on the internet. So what is loneliness? It's a discrepancy between a person's desired and actual social relationships. It's an emotional response to social isolation, which is something that threatens our basic survival. And so when you look at loneliness, it's not based on the quantity of your relationships, but really the quality. And we should really put it in kind of these primal emotions and drives of like hunger and thirst, because it's so important for our survival and so innate to all of us. In this slide, this was an experiment that was done where they subjected individuals under fMRI to a rejection experience. It was a ball game that they played with computer animation, and slowly the people started to exclude them, and people actually reported distress in this. And when they did the fMRI, they found that there was activated activity in the anterior cingulate cortex. Now, what's interesting about that is that the anterior cingulate cortex modulates our emotional response to physical pain. And so it also appears to be modulating that same painful response that is social isolation. So think of loneliness as social pain. Social isolation is different. This is more objective measure of your lack of social connections. So it doesn't necessarily lead to loneliness, although it frequently does. Loneliness is an emotion, and one quote that I thought was really helpful in summing the quality of your relationships up was Carl Jung's quote, "Loneliness does not come from having no people around, but from being unable to communicate the things that seem important to oneself." or withholding certain views which others find inadmissible. In a sense, not feeling validated in our relationships leads to loneliness. When you think of loneliness, this can be a good picture to kind of sum it up. The person who's surrounded in the crowd, but at the same time feels extremely lonely, disconnected from everyone, despite being objectively around people. Loneliness gets a bad rap with the mass shootings we've had lately, often mental illness and this idea of the loner comes into play. And this is a Newsweek article in 1998. Russell Weston Jr. Went into the U.S. Capitol in an attempt to shoot multiple people. He did shoot 2 police officers, but then was stopped. But this was how they dubbed him, the loner. It's likely an extreme form when people become socially marginalized that they're going to act in this aggressive manner. Celebrities can be lonely. Janis Joplin famously said that in true hippie fashion, on stage I make love to 25,000 people and then I go home alone. She ended up passing from a heroin overdose at age 27. So this is a great framework for when you're first evaluating a patient's loneliness and where you might want to target specific aspects. I want you to think of it in 3 degrees. Intimate connectedness, this is your close personal confidants. Marriage is a significant predictor of whether you have intimate connectedness. And second would be your more relational connectedness, your friends and family, a little bit more extended, not your close confidants maybe as much. And then your collective connectedness. This is the groups you belong to within society. Your alumni association, your church, your fraternities. These are all kind of the groups that we belong to. Your sports teams you might root for. And now I need to discuss solitude because it is different than loneliness. And solitude is really finding comfort in being alone. And I think we've all experienced that where we just needed some space, time with ourselves. There was this really great quote. It was an editorial that was written by Simon Wine, and he discussed solitude in relation to palliative care and dying, and the idea that solitude is really important at the end of death because at the end of time you leave this earth alone. And so he said, to be in solitude and bear the silence, even to enjoy it, to hear one's thoughts, follow them, smile ironically to self at some embarrassment, but always to sit quietly and know one's mind. I think that really kind of sums it up. There's a whole literature in solitude that if you're interested in, you should check out, but some of the things that are beneficial are perceived freedom. Creativity is very highly associated with solitude, and intimacy and spirituality. Here's the picture to kind of think of solitude when you compare the two between loneliness. Here, this person looks pretty content, experiencing the cosmos and their connection to it, appreciating that. And I think it would be good to give you this objective measure. This is also something that is used in almost all the studies that I'm going to present here to evaluate loneliness. This has been validated multiple times since 1978 when it was created. It's the UCLA Loneliness Scale, and it basically has patients rate these 20 questions evaluating loneliness, and then you score it, and it gives you a sense of how lonely people are. And I would encourage you to consider using this if you're struggling to figure out if someone's lonely in your clinic, because you might be surprised that they come across having all these relationships, but that they perceive them to not be that way. So why do we need to study loneliness? Why does it even matter to us? Well, when we look at the demographics of loneliness, this was a recent study that was done in 2018 through the Kaiser Family Foundation. They randomly selected 1,000 people in the US, the UK, and Japan, and evaluated whether they were lonely and how much of a problem they felt it was. Here in the US, we're seeing about 20% of people, 22% in this study, that are feel lonely and that reported as a severe loneliness. And I thought it was interesting that even though Japan had a lower percentage, they still had the same percentage of people that thought it was a major problem there. So in whom is loneliness highest? And when we look, we find that the number one thing in all societies was having one or less confidant. This is connected to the intimate connectedness. So this kind of shows how important that intimate connectedness degree of loneliness is, and that if that's lacking in a patient, that the others might not be helping much to alleviate their loneliness. Other things are having a mental condition or a debilitating physical condition. Others, financial issues and being widowed or having negative events in their life. 60% of people, pretty much about across the board, reported some specific reason for the cause of loneliness, and the most common was a death of a loved one. So there we have probably that loss of a confidant, someone in that intimate circle. And then physical health and mental health was also reported in the UK. And so I just want to point out that the death of a loved one and physical health tend to be pretty specific examples people give. Loneliness is a common experience. 80% of those less than 18 years old and 40% of adults greater than 65 reported feeling lonely at least sometimes. And as we'll continue to talk about, loneliness kind of distributes in a bimodal fashion, in which it's more in younger people, less than 21 or so, and in our older population, greater than 50. Loneliness tends to diminish in middle adult years. Most likely you're getting married, you form some close relationships. And loneliness tends to increase with old age. So studies have shown approximately 15 to 30% of the general population experiences chronic loneliness. It's probably most consistently around 20%, just like the previous study showed. And that is in the US population. The physical effects of chronic loneliness, they tend to appear later in age. And I just want you to keep that in mind because that'll come up here a little bit later. This is to show that there have been studies that looked at mortality risks in general populations. This was the health and retirement study that was done in our older population. They were followed for 5 years, and basically they tried to look at every factor and see what was causing people to die earlier. And what you find is that on this survival scale that chronic loneliness and situational loneliness both are significantly causing increased risk of mortality. And the difference is obviously bigger for chronic loneliness. When you look at the hazard ratios, you see that for chronic loneliness, which is the highest, 1.83. So for every 100 person that dies in the non-lonely group, 183 have died in the chronic loneliness group. And then there was another one that was the longitudinal aging study in Amsterdam. This has been multiple cohorts that were followed over decades. It was started in 1992, and every 10 years they look at another cohort. And once again, it showed this concept that loneliness is leading to higher mortality in people. On the reverse side, does it extend your age, having social contacts? And I saw this TED Talk a while ago that really kind of helped inspire this, and it was a TED Talk by Susan Pinker. She talked about this community in Sardinia, which has a lot of centenarians, which are people that live to 100 or greater. What's different about this population is men and women live to about the same age here, which is not true in most other cultures. It has 6 times as many centenarians as the Italian mainland and 10 times as many as in the US. When they looked at a study of this group of community, they found that genes were only accounting for about 25% of the extent of living longer. And actually, that would mean lifestyle is about 75% of the rest of it. When you look at this picture, you can see their city actually is really close together. And so if you went out on the street, you'd probably see a lot of people and make a lot of contacts. And when you look at a meta-analytic review of social relationships and mortality risk, you in fact find in this study that social relationships, having high versus low support, having that high support allowed you to live longer, essentially. It's helping to increase your age. And another was a measure that was high was your social integration. This is your ability to manage social norms, things as simple as how do you share food properly at the table, or as Seinfeld had, how to dip a chip properly at a party. So these are important things. The other thing is that social integration also is something you can learn to do very, very well. And what I'd encourage is that you start saying hi to random people when you're in the elevator, when you see the postman. This is what social integration is, and it helps you live longer. Does loneliness lead to physiologic and psychological consequences? And this is an important thing to look at because we've seen that it affects life expectancy. Now, let's see what is actually maybe underlying this. So I want you to think of loneliness as a wear and tear process. Remember I mentioned that the physical effects of chronic loneliness tend to come up more in old age. So it's really the stress of loneliness. It is a social stress. You are isolated, you're not connected, you can die because of that. And so this stress actually leads to kind of a more chronically elevated allostatic load. So you want to think of this as this is a deviation from normal homeostasis to try to do something to get you to connect, as we'll talk about in an evolutionary sense here. And so there's this change in the homeostasis, but when persistently, it's going to grind and wear and tear on you. And so this allostatic load is actually particularly damaging to the cardiovascular, endocrine, and immune systems. So there was several studies that were done to look at the physiological responses of loneliness. There was a study that was done in older adults in Chicago, and they looked at a large cohort of patients to see if loneliness correlated with epinephrine in the morning, which would be a sign of stress. And in fact, it was higher in lonely individuals, which is quite interesting. Then there was also a study done on undergraduate students, and they were basically buzzed every day, had to complete a loneliness questionnaire, had to give a saliva sample every morning, cardiovascular parameters were measured, and they were buzzed about 9 times a day for a week. And when they looked at people who were lonely the day before, the next day, their saliva samples showed higher rise in cortisol, kind of showing this association. So loneliness also has predicted changes in DNA transcription that dampen the ability for cells to shut off the inflammatory response, particularly in older adults. And with those undergraduate students I talked about, the Ohio State students, they were shown to have basically a higher baseline blood pressure when they were lonely. They also were subjected to a task where they were brought in and they had to give an impromptu public speech. And the lonely and non-lonely were all evaluated for their blood pressure, and they found that even though the lonely people already had high blood pressure, it was increased further, just as the non-lonely were. It just wasn't as high. So we see that there's actual physiologic changes. And this is kind of the proposed mechanism for loneliness-induced cardiovascular disease. This was a newer paper, and it shows kind of the interaction where loneliness from a top-down approach is affecting your immune system through inflammatory genes and cytokines, causing inflammation and oxidative stress, which would lead to atherosclerosis. You also see glucocorticoid resistance, and you also see this vasoconstriction that would lead to higher resistance in your vessels and subsequent change. You also see then subsequently behavior changes that occur. We'll talk more about them. The psychological consequences of loneliness. When you look at the studies, loneliness tends to cluster with several symptoms that you might expect. Depressed affect, shyness, low self-esteem, anxiety, hostility, neuroticism, introversion, fear of negative evaluation. These all kind of cluster together. But the question really is loneliness leading the role in this, or is there something else in that cluster? And this was a really nice study to kind of clear that up. It was done in the Ohio State students again, and they basically evaluated all of them, if they were lonely or non-lonely, sorted them into those groups, and then assessed these specific clusters of symptoms. And as you can see, in this top section, that the more lonely people had, the more negative of the negative symptoms, less positive mood. And so what they decided to do was then they split up a group of the Ohio State students and hypnotized them to feel lonely or feel not lonely based on an experience they had. So the lonely people had to go back and think of a time they felt very lonely. And after that was done, you find that this is almost like a fingerprint analysis where it matches in forensics or something. It's like, it's so perfect. The induced loneliness actually fits with these symptoms, and it gives credence to the fact that loneliness is playing a leading role here. Loneliness has also been found to diminish self-regulation. There was a study that was done called the Unpleasant Tasting Nutritious Drink. I kind of gave it that name. Participants were sorted into future alone, future belonging, and misfortune control groups. They were all given these psychological testing, and then people who were randomized to future alone were told, you're not going to have many social connections later in life. Future belonging, you're going to belong. And misfortune was just, you're going to probably break a lot of bones as a control. And when they gave them a drink and they said, hey, this is really nutritious. If you drink as much of this as you can, we'll give you more incentive prizes, more money and stuff. But it tastes really bad, but it's very nutritious. The future alone were less persistent at the task, whereas the future belongings, they were willing to endure this unpleasantness for that future payoff. I think that's kind of interesting. And then in kind of a reverse, or another type of self-regulation, looking at ability to self-regulate kind of unhealthy behaviors. So this is the cookie taste test. They went out to the undergraduate population and made sure that in general people felt that eating cookies was unhealthy. And then they basically created these socially disconnected and socially connected groups. And the socially disconnected that was done by, they basically had to decide to work together with people. And this was all just a ploy. At the end, they told them, in the socially disconnected, no one wanted to work with you, actually. And then the socially connected, they wanted to work with you. The socially disconnected group, they were then, and the socially connected, they were both given a plate of cookies, bite-sized cookies. And the socially disconnected ended up eating 9 cookies, which was on average, which was 2 times as many as the socially connected. So they ended up eating more, not regulating that unhealthful behavior, that perceived unhealthful behavior as well. And in fact, the socially disconnected who ate the most cookies tended to rate them as mediocre, which was interesting. Don't worry, they did tell them that was all a ploy and they're not going to be alone in the future and stuff. Ethically, they had to do that. So how does self-regulation translate to our later life behaviors? And what you see is that, interestingly, overall, when you look at young lonely people, they do no worse than social people in terms of health damaging behaviors, such as alcohol, smoking, exercise, and diet. Now, that's in general. Of course, there's definite risk that they can develop that, and some studies have shown that. But in general, whereas when you look at older adults, the difference is very consistent. That socially contented older adults, they were 37% more likely than lonelier adults to engage in physical activity of 10 minutes per day. And they also looked at diet, and lonely adults tended to consume about 39% of their calories from fats versus 29% in the non-lonely. It also affects your ability to manage stressors late in life. Lonelier adults tend to have a greater marital strife, more run-ins with neighbors, and more social problems overall reported in studies. And the socially contented, they tended to report about 4.8 chronic stressors, whereas lonelier adults tended to report 6 chronic stressors on average. That's a 25% difference. So now let's move to kind of my favorite part of this, which is building the framework for how we should understand loneliness and how it affects our behavior, because that will be what we can use to creatively work with our patients who are lonely to figure out how is this process working, how are these behaviors interacting, and what can we do about it. So when you look at loneliness, it is social pain, to remind you of that second slide we went over. Physical pain, it protects us from physical dangers. Social pain protects us from social isolation. And our social bonds are so important to the survival of your genes. In order for your genes to replicate, you need to make sure that your offspring live. And humans were not born with the ability to just climb on mom's back and like an ape or anything, or even just go and live its life. Clearly, we need a lot of help along the way. And so social bonds were so important for us to continue our genes in the gene pool. And that's why now we have paternal nurturing as well as maternal, which is different than a lot of other species. And the reason that we require so much dependency initially to survive is that we were born with non-fully developed brains, because if we were born with fully developed brains, then women would not be able to walk. It would be impossible to make it out of the birth canal and have a pelvis that is suitable for bipedal movement. So we need time to develop our brain over that time and develop to our full functioning. Key themes of loneliness: evolution reinforces a preference for strong human bonds by selecting for genes that supported pleasure in company and feelings of unease when involuntarily alone. So you do actually see genetic component to this, and there's studies that have shown that as well. We feel secure when we're connected. That's the reason that we feel secure, is because it's important to our survival. And as a corollary, we actually feel physically threatened when we are isolated. What's interesting is, loneliness, it should be making us want to motivate to connect. Well, it does. And there's one important feature of that, though. When you have a higher motivation to connect, you have a higher risk of being vulnerable to a foe, potentially. And that could affect your survival. So it's extremely important that you make friends with a friend, and maybe even see friends as potentially foes if they're going to be a detriment to you. So I want you to think of that in this next context. Loneliness changes the perception of our social interactions. And here's some studies that kind of show how that perception changes. There was a group of lonely and non-lonely people. They were given a diary, and it was filled with all kinds of interpersonal and collective social information. And they then, at the end, had them read that and answer questions on it. And lonely people actually remembered a greater proportion of this information. So they want to connect. They're reading into that connection. Then they decided to test how lonely people perceive nonverbal modes of expression. So 24 faces were shown with 4 different emotions: anger, fear, happiness, and sadness. And if you had increased loneliness, you made less accurate interpretations of these expressions, which is interesting. Why would that happen? Why is it affecting that? Another thing that happens, it even happens in verbal language. When lonely people were subjected to basically some vocal recordings, they did pay greater attention to kind of the tone of it. But at the end, when they tried to understand the meaning of what they were saying, it was much less accurate. This is a really cool study that was done, and these next 2 slides talk about it. And basically, they took lonely and non-lonely people and put them under fMRI to kind of see what's activating, what's not. And so they basically showed them 4 different types of images, categories of images: pleasant social interaction, negative social interaction, pleasant objects, and negative objects. And when they looked at the study, they looked at one area, the ventral striatum, and there was a difference there, and that's involved in pleasure response. And what they found was non-lonely people actually showed greater activation in their pleasure response when they saw a pleasant image of a person as compared to a pleasant object. So they're getting more out of that interaction. A lonely person, interestingly, shows a weaker response in the ventral striatum when shown a pleasant person compared to the pleasant object. The pleasant object was more pleasant. And that seems counterintuitive. Sure did to me. But when you look at studies, lonely people do self-report that their social interactions tend to be less uplifting overall. So next they looked at 2 other areas of the brain that showed significant differences. And within this same framework of showing the faces and the objects. And they found that lonely people paid far more attention to the negative images depicting people. And that was measured by activation in the visual cortex. So they were seeing these negative images and really responding highly to them. Lonely people, they also had weaker activation at the temporoparietal junction, which is when they saw pictures of people in distress, peril. And what's interesting is temporoparietal junction is an area that is implicated to be involved in theory of the mind and kind of perspective taking. So lonely people respond more heavily to negative images in a sense, and they don't respond to people even in help as much. So this kind of also talks a little bit about what's going on, because when you think about that, for some reason, lonely people are feeling threatened in the context of this. They're feeling threatened by these negative images. And you can see kind of this concept of it affecting sleep as well. And that when you look at sleep studies of lonely individuals, you find that their sleep fragmentation is affected, but their sleep duration is not. So they're more vigilant in general. They were more vigilant looking at the images of the negative faces, and it seems like even in sleep, they're more vigilant. And it makes sense. If you don't feel secure in your social environment, you need to wake up and kind of assess your environment, make sure things are okay. This has been replicated in multiple experiments, but the one that I liked was a cross-sectional study that was done on a very homogeneous communal group in South Dakota. And they controlled for multiple factors, including depression, anxiety, substance use, and it showed that. So I want to kind of summarize the behavioral data, and I've already kind of given a clue to what's going on here, but loneliness seems to reduce pleasure from pleasant company. It also creates a narrowed perspective, inordinately focused on threats, real or imagined. And when I look at saw those studies on the facial images, it reminded me of, if anyone remembers Dr. Gabbert, when he came, and Dr. Pinto, they talked about borderline personality and their threat response to facial images. And it was kind of that same kind of process going on, which is interesting because I imagine borderline personality has a lot of loneliness associated with it, as you can imagine. So with these two responses happening, decreased pleasure, increased threat response, you have kind of less socially skilled responses, as evidenced by the fact that people couldn't interpret those nonverbal and verbal cues when they're lonely. And when you aren't socially skilled, you're going to end up behaving in a way that ends up reinforcing that isolation, so that potentially you can get in a dangerous cycle of loneliness. This is kind of the framework put together to kind of see how loneliness is interacting in our environment. And I'll use an example to try to put this together for you. So a toddler is with mom and gets angry and hits at mom. So mom puts the child in timeout, form of isolation. He's been removed. So what's going to happen? If we look here, there's the bubble that says more negative displays social interactions and affects. So the child's going to feel badly. I don't know many children that feel good being in timeout. And so they're going to have this more negative affect. So they then perceive this social isolation. But they're also motivated to connect, because if they don't connect back to mom, they're going to die. I mean, it's that simple, unless mom can get over that fact. And, within that context of the connection is the fact that they're hypervigilant. They're monitoring for friend or foe in order to connect back. Is mom my foe? Is she not? So they're evaluating probably mom's responses while in timeout and seeing, is she still mad? Is she staring me down? What is her response? And this actually affects attention and memory biases. And so you end up perceiving kind of these negative threats that are in the environment. You pay more attention to that. You remember those. And so that's in timeout. The theory is that this will keep that behavior from occurring again, right? So the memory of this negative experience is in there. And so what happens is this kind of behavioral confirmation process where the child starts to feel depressed, hangs their head in shame, their self-esteem goes down a little bit. These are actually good things. This is going to help the child to be able to be integrated back into the family unit in a way that serves the whole family unit, makes them more adherent, makes them more resilient, and helps them understand social behavior. So these are actually good things. Maybe the child was a little narcissistic and thought that he was better than mom, and that lowered self-esteem actually helped in that regard. And so what happens is maybe mom notices this, reaches out to the child, so now they've got the attention of mom, let them know that, hey, I'm not feeling good about what I did, and then they can maybe have a discussion about why that behavior is not appropriate and why the mom still loves them and everything, but that this is a learning experience. What can happen, though, is that we can get stuck in this circle on the right side. And particularly in our contemporary society, we can, because our survival isn't as linked as directly as our ancestors would have been in a tribal hunter-gatherer community. And so we can kind of maintain this negative affect and continue to be in this perceived isolation, leading to hypervigilance. And it can become this chronic process where in the background you have the wear and tear going on from increases in the HPA, increases in your sympathetic system, diminished sleep quality. So you end up having this lower quality of life. So that's kind of loneliness in our society. Actually, it's not really geared towards making us recognize the importance of loneliness and what it does for us. What happens when you're in a chronic process is you actually, over time, have these loss of executive function, evidenced by the decreased self-regulation. They've also found issues with attention and cognitive issues, rational thinking. And so that affects now their ability to think over time too. So hopefully that helps you understand what's going on here and what evolutionarily through experimentation is being conceptualized here. And it was important for me to have you make sure that you understand that, because it is the model that we're going to use now to kind of look at social internet behavior and whether it can predict this in lonely individuals. So I will say that looking through the research, it was pretty difficult. There's a lot out there, but not enough. And there's really a lot of cross-sectional studies that are done with social internet use, and not many longitudinal studies, which would be much more effective in determining the direction of causality for loneliness and behaviors. So it's definitely an area we need more research, but there was some interesting associations that we can uncover. As you probably have seen, there's been a lot of articles on loneliness. There's been a lot of concerns that online technologies are increasing loneliness, and what do we do about this? And so I'm sure you've all come across that. I mean, I'm seeing it all the time now. I don't know if I'm just, my attentional biases are on that or what, but. So with social internet use, there is a framework for kind of understanding what motivates behavior on the internet. There's two basic hypotheses that were formed in two different papers. The first one that was formed was that of the displacement hypothesis. And this essentially is that loneliness is associated with social internet use because people end up displacing their offline relationships and activities with online ones. So essentially leaving face-to-face interaction, now I'm online. If that's what's motivating you, that's the displacement hypothesis versus the stimulation hypothesis. And this is that social technology is useful for reducing loneliness. It enhances existing relationships and offers opportunities to form new ones. And so there's kind of this interplay. What I'd say is, from my research, it seems like they're not mutually exclusive and can be going on at different times depending on the motivation. When you look at social internet use overall, some of the studies that raised a lot of the concerns were in regards to total internet time and its association with loneliness, and total internet use, frequency of Facebook use, and so some of these studies showed that and brought up this alarm in society. So there are contradictory results in late adolescence and adulthood, but overall, when I looked at studies that showed time spent online and total internet use, it was associated positively with loneliness. So the more time you're spending on the internet, you're more likely to be more lonely, or at least associated with that. Versus if you look at time spent chatting, in one study, they looked at time spent chatting with friends, and that was actually associated with a decrease in loneliness. And then what about Facebook use? When you look at the frequency of Facebook use or time spent on Facebook, it was associated with increased loneliness. Versus if you have a large number of Facebook friends, the higher your number of Facebook friends, the lower the loneliness. So here's where the contradictory results are in. You know, with number of Facebook friends, what probably is happening is if you have a large social network online, you likely have that offline as well. So let's look at the three age groups because I think you have to kind of look at it differently because different age groups use social internet differently. With childhood and early adolescence, you see that typically they spend time communicating with friends online overall. It's not as much searching the internet or anything else like that. It's more instant messaging kind of behaviors. And in regards to that, so far in child and early adolescence, I couldn't find any studies that showed an association with loneliness in children of this age group. Now we get to the late adolescence and adulthood. That was kind of the more contradictory results, but is a lot more studies done in this population overall. And this marks kind of a transition in your behavior where you start communicating with friends and strangers. And when you look at the motivations for Facebook use, it influences loneliness. So some support I found for the stimulation hypothesis was that if lonely people are intending to go on Facebook to make new friends, it reduces loneliness over time. Versus there was some support for the displacement hypothesis that when lonely people were going online to compensate for poor social skills, it actually increased loneliness. When you look at social media use in older adults, this is a cohort that's extremely vulnerable to social isolation. And so that seems to influence a lot of the studies the results of the studies I found. Overall, it appears to reduce loneliness in the older population. Time spent online was actually correlated with lower loneliness in this particular population, which was interesting. Overall, when you look at time spent online, it was associated with higher loneliness, but in this specific age group, it's not. When older adults use social internet for specifically communication with others, you find lowered loneliness in them. And when social tech is being used more for entertainment purposes and information in older adults, it's associated with higher loneliness. So here's a discrepancy between how the internet was used. And I thought it was really interesting because there were two studies that looked at using the social internet as a behavioral intervention for older adults to reduce isolation. And in one particular study, they basically had a trainer come on and train them how to use the internet and for social engagement. And they found reduced feelings of loneliness in this population subsequently after this. Now you might say, well, maybe that was from them interacting with the trainer. But even after 36 months had persisted after the training was done, that loneliness was still reduced. So we're seeing that behavior likely was modulated, reinforced, and used appropriately in most of these older adults. The internet's not all bad. I thought it was interesting too because one person looked at social comparison orientation. This is what would probably motivate how you interact online. And the social comparison orientation it's basically your inclination to compare your accomplishments, your situation, your experiences with those of others. And this author of this study argued that this should be used more in our studies because this seems to affect what we get out of our internet experience. Typically, people who have a social comparison orientation, they tend to have a high chronic activation of the self. They tend to be socially oriented, and they also tend to have more negative affectivity and uncertainty of their self. So he looked at Instagram, which I think was interesting because I remember seeing a study about how Instagram is the biggest offender of causing mental health issues. It's worse than Facebook and everything else. So let's see how that matches up. He used this in the context of the social comparison orientation. He looked at 208 undergraduate students, and when he looked at just Instagram interaction and Instagram browsing, no matter what your orientation, both were related to lower loneliness in some extent. And but the interesting thing here is, if you look at figure 1, there was another thing he looked at with if you were having this social comparison orientation, and it didn't change your loneliness if you had a high social comparison orientation. It kept it the same. But if you had a low social comparison orientation, then you were getting reductions in loneliness. So the social comparison orientation kind of maintains your loneliness level. When he did look at Instagram broadcasting, it was associated with higher loneliness. I couldn't find other studies that really on that, but that was what he found. So people are reaching out. That kind of makes sense, right? You're trying to connect, so you're broadcasting yourself. You're saying, come interact with me. So I just want to remind you kind of this framework briefly again, because we're about to kind of put it together with some behaviors that we see online, and how this model is, you could probably answer these questions that I ask based on this model and get it right based on the association studies. And so when we think about it, that key part is that there's that hypervigilance to social threat. And that's because you're trying to evaluate friend or foe. That's pretty difficult to do on the internet. You don't have nonverbal cues, you don't have verbal cues, and your social skills are diminished in general. And when you do have hypervigilance over time in that process, what you find is that lonely people become very passive, avoidant copers, right? I don't want to feel shame, guilt, depression, low self-esteem. And so you start to withdraw from interactions that would produce that, since those are socially oriented kind of emotions. And this happens on the internet in terms of looking at preferences of lonely people. What you find is that lonely people, they tend to prefer online communication to face-to-face interaction, and will potentially even substitute it. Higher loneliness was also associated with forming new friendships online, which is good. You're reaching out, creating friendships, but then lonely people tend to not take that into the real world and turn it into a face-to-face interaction that would give us the social connection, the social emotions that we need. And in general, lonely people prefer the anonymity of the internet in reports, and like to experiment with identity. This is this kind of sense of that they can hide behind in a non-authentic self and reinforce that non-authentic self over and over. What was also interesting was when they looked at searching behaviors in social internet, particularly in Facebook, that lonely people were associated with passive lurking behaviors, where you looked at people's profiles, pictures, everything else, but didn't put update statuses, didn't try to connect with people, do even click like. It was more this lurking behavior of of what people are doing, but not connecting with what they're doing online. And on the internet, it's harder for someone to recognize that you're feeling poorly and bad. It's hard for them to recognize you're depressed, you're feeling shame. They can't see you hanging your head and say, hey, what's going on? Can I help you out? So the internet, in this sense, has to be something that we really understand is creating this barrier, this wall that can be hidden behind. I also wanted to look at within the context of this vulnerability that you're now at. If you're hypervigilant and trying to connect, the hypervigilance now can kind of be put on the backside, and because what can you use it for? How do you evaluate a comment online or someone sending an email to you. You don't have the verbal and nonverbal cues. Even if you're interpreting them poorly, you can't interpret anything really from that. So I wanted to ask the question of, are they more vulnerable? So looking at cyberbullying in general, um, of course, victimization via cyberbullying is associated with increases in loneliness. That would make sense. They're being shunned online. But what was interesting was that a study found that loneliness is actually a risk factor for becoming a victim of cyberbullying, kind of fulfilling what was the hypothesis of based off our evolutionary framework of can they evaluate foes properly online? And so I basically wanted to move then on to self-regulation. And in particular, I wanted to look at internet addiction to see, does this associate? Internet addiction is not a DSM diagnosis. It's in the research phases. But when the proposed criteria is basically kind of the same as addiction and gambling in that there's a preoccupation, a tolerance, a dependency, withdrawal associated with psychological mood changes, and that there's overuse and even functional impairment. And when you look at surveys of prevalence rates, you see that I found studies that it was between 1.5 and 8.2%, with the most common being really in the 2% range across US and Europe. When you look at people with internet addiction, there was a consistent positive association between loneliness and problematic internet use in multiple studies. There was really no difference in age cohorts when this was there. And what this leaves out is that it's unclear what the directionality of the relationship is in this. Is loneliness causing problematic internet use? Is internet addiction causing loneliness? I did find one longitudinal study, and it showed that internet addiction predicts increases in loneliness over time. So that kind of showed that there is at least internet addiction causing loneliness. I would say that likely this is bidirectional and can change over time depending on your motivation and behaviors for internet use, that loneliness can increase these behaviors reinforce loneliness, and it's this kind of dynamic relationship between the two. That's what I suspect will be found when we have more studies. And so I just kind of wanted to leave you with a kind of an idea of how you can help your lonely patients. I'll leave the creativity of the other stuff up to you a little bit within that framework, but when you think of internet use, I really think that it's important to, if you identify this as a potential issue or behavioral issues that could be translating to the internet in terms of social use, that you help them see the internet as a way station to a destination, that destination being hopefully a face-to-face interaction. That could be via Skype or FaceTime even, a phone call, or physical contact and face-to-face. So I think that's really important to kind of make sure our patients realize that they need to take it offline. Remember that lonely individuals tend not to take those friendships that they make offline, and so kind of reinforce loneliness and they don't get the benefits of that relationship as much. They already have a decreased pleasure response, and now you're kind of decreasing that chance even more. So last thing I want to do is just mention John Cacioppo. I couldn't find research that he wasn't the author or that he wasn't cited in a study on loneliness. I mean, he's just so prolific in this area. I was going to try to reach out to him over the summer, and unfortunately I found out he passed away at 66 in March of this year. He was a leading investigator of loneliness. He's a founder of social neuroscience. He was a professor at University of Chicago. He did the Ohio State student studies. He He was involved in the fMRI studies I talked about. He was involved in a lot of all those kind of studies, and that framework that we put up there was his conception with another doctor. He also served as the director of the Center for Cognitive and Social Neuroscience and the chair of the social psychology program there. He has some great talks online if you want to learn more, and from someone who can really put the pieces together. He's quite interesting and very friendly, pleasant guy. You can see that he learned how to integrate himself well and in response to his studies. So I just want to say thank you to everyone for coming. I really hope that this gives you a framework for how you can conceptualize how you approach your patients. And I think you can get creative here. You know, it's not just go to church or go to the YMCA and hang out with people, right? Because they're hyper vigilant. They're not going to integrate. It's beyond that. It's about teaching social skills. It's about finding a non-threatening environment. One other emotion that I thought is interesting is play. Play can be a great way to maybe decrease that threat and is a natural kind of instinct we have to socially bond. How can I bring play back into a patient's life? Lots of different ways you can conceptualize this. And I want to say thanks to my mom. So I was born into this world and luckily not alone. And thank you for coming, Mom. She's a family doctor and has been a really big influence on how I practice medicine and my appreciation for psychiatry. So thank you. And my sister's up here, my mom, my sister, and my girlfriend's over there, Courtney. She was so supportive during this time as I was having my own sympathetic response and stress to all this. She was very supportive and helping to reduce my loneliness. And then residents, like it's been awesome. I really loved getting through this with you guys. I mean, it's great to vent, and it makes you feel less lonely when residency can be such a lonely experience sometimes. And my friends, of course, I want to thank the University of Louisville Department of Psychiatry. I've really enjoyed working with all you attendings. I've instilled parts of you in me, and I really appreciate all the time you took to educate me. In terms of supervisors, Dr. Frierson was my first year supervisor. He helped me get acquainted with psychotherapy. Dr. Goodwin has obviously been a very strong influence on how I conceptualize my psychiatric approach. And I really appreciate that and all the stimulating discussions. And Dr. Pinto is my supervisor now. He's really helped me kind of with the nuances and my identity and boundary, setting effective boundaries. So thank you to everyone. And that's it. We do have time for questions. Good, because I hopefully have some. Ali? Okay. I didn't look specifically at that. I limited it to social internet use being online kind of activity. But I think you could make some predictions in regards to that, right? That if you're texting someone, if you're just spending time texting, it probably is reducing your loneliness. Now, if it's leading to a face-to-face interaction, it's probably reducing it more. And I would correlate to that to the fact that, you know, we did see that chatting online, which is kind of very similar to texting, is shown to reduce loneliness. So in that regard, that's what I predict based on the model. Gotcha. Yeah, I'm not sure, and I don't know that there would be a big difference. I think what is key here is to remember it's that initial motivation of what you're going on there to do. Is it passively lurking, which is not going to be helpful, versus is it to engage with others? And so I don't think the device would have a difference, though I don't even know if that was looked at. I didn't. That's what I want. Not that I can recall. There is a paper that Cachopo did on a neurological perspective to loneliness. I don't recall all the information from it. I will say there was an interesting study that was done. This is more about social isolation though, so I don't know if it translates completely to loneliness, but I'll mention it here. Um, there was a group of researchers that recently accidentally found a difference in the volume of the dorsal raphe nucleus in mice that are separated into cages and isolated. And then when they were reintegrated, they saw behavioral changes where they were more either aggressive or backed off and didn't socialize as much. So they saw that behavior response that loneliness does have. And of course, the dorsal raphe nucleus has both serotonergic and dopaminergic projections. And so that is interesting. I think the key is to try. It's nice when those things correlate with what we're seeing, you know, um, from a behavioral perspective. But I think the key is to that loneliness is going to be it's multiple areas playing into this, and so to get pinned down to one area or one neurotransmitter doesn't do you any justice clinically, um, at least at this time. That's a really good question, actually. That would be a cool area to check out. Uh, I mean, I imagine PTSD is pretty lonely experience in general, so there's probably within PTSD, I imagine there's kind of that bidirectional relationship where it's loneliness is influencing PTSD responses by causing you to withdraw, and then the actual PTSD causing you to withdraw, feeding into loneliness. I can't recall any specific studies I looked at though. Mhm. Sure. And I think that kind of comes into that social threat experience that you have with loneliness, that you're gauging these social threats, and PTSD may have a higher hypervigilance kind of response overall, I'm guessing, because I think loneliness kind of is a little bit more subtle in how it presents this. We don't see it as much, whereas PTSD, you see it, you see the response. Lonely people aren't going into a mixer and then just from my experience, I haven't seen someone just flip out aggressively or run out of the room. It could be, but with PTSD, it seems like there's something different going on there. Not that it's not connected in some way. Um, I don't know if I answered that well, but that's my best attempt. I think you had your hand up earlier, so I want to make sure you. In mental health workers. Mm-hmm. Yeah. Yeah, I think that's a really good point because yeah, in our clinics, I mean, how many people are lonely? Is it 75%, maybe more actually, rather than 20% of the general population? I mean, most of our patients have at least experienced probably some form of chronic loneliness, and then as they get better, it resolves. So there's probably that fluctuation. But that would be interesting. And then, with suicide, I mean, you have loss of self-regulation, you have that loss of ties to others, and that you're perceiving you're isolated. When you lose that sense of ties, I mean, it's going to increase suicide. And there are studies that show that loneliness increases suicide. Providers, I mean, I haven't seen anything in that. It'd be interesting because being in a competitive environment, which mental health providers are in, you're in this academics maybe, or it's pretty high stress level. That with that, you probably would see loneliness potentially be higher. And I think it would depend on the practice too. Like if you're practicing solo versus with a group of colleagues, you probably can connect with them on these things. So I think there's levels to what you're asking too. Um, yeah, I mean, you definitely probably perceive that maybe you socially aren't as inept for a while. I'm sure it at least has an acute response, but I would say that maybe loneliness, we need to make sure we remember that it is a good thing when it works right, right? So in that sense, it might make us reach out to our colleagues and talk about these things. So in a sense, it might give us the social bonding that we need in that situation. And that's how we should be conceptualizing this. Loneliness acutely is good for us. It's a good response, even though it feels bad. And so there's a lot of factors at play there, but thank you. Yes. Good. That's a good question because it is somewhat of an alternative social media internet connection. I didn't see studies specifically on that. Because I tried to limit it to these certain things I could put in that social media umbrella. But I will say that Facebook update statuses was or broadcasting was the same kind of thing as Instagram, that they have higher loneliness, but then it reduces it especially when people respond to it. Um, and So yeah, but I haven't seen it with other ones. And honestly, I don't know that there's going to be much research, particularly in Twitch, because it's so new. This field like desperately needs research, desperately. We spend so much time on the internet, and right now, I, it's so. I imagine in other areas of that you'd want to look at, there's not much research. And there's a whole area called cyber psychology now that people are doing research into this because the internet and social media can be such a powerful tool for connection, right? The internet is not innately bad, it's neutral. We perceive it as bad because of a lot of these issues going on, but it's our behavior that's on the internet that's leading to that. Um, just as another thing, Dr. Goodwin, you had mentioned yesterday actually, like pornography, is that an issue, with self-regulation and loneliness? And you would expect it. I did a quick look up to see. There were 6 papers that came up with pornography and loneliness, and only 2 were kind of relevant, and they weren't really that great of studies. The one showed kind of a bidirectional relationship between pornography use in associating with higher rates of loneliness, which makes sense. And there was another study that was done with children in Israel, teenagers, 14 to 18. So I don't know how representative that is of someone who might get into pornography. Not that it can't happen, but I suspect that it's a more gradual process that maybe as your intimate connectedness isn't being fulfilled in your 20s or so, that's when you're probably going to see pornography become an issue with loneliness. But there isn't studies really on it. There's a lot of opportunity if you are interested in this. There's a lot of questions to be asked. And did you have a question? It seems, yeah, I mean, I didn't, I can't say specifically I looked at like maybe someone who has structural differences in these areas and then subsequently has higher rates of loneliness. It may be out there. But I would say that my intuition and gut says that it starts with that loneliness perception, that emotion, and then the subsequent changes in how you're perceiving follow as a result. And that it's starting there though, with perceived isolation. That would be what I would suspect. No, but that's a perfect interesting study to do because you could actually then correlate it with the physiologic changes, correlate it with that association maybe with loneliness. And really, like I said, there's no longitudinal studies, and maybe we're just waiting for them to come to fruition because they were started and they just haven't been finished and published yet. But hopefully we have some in the works right now because it's all cross-sectional data and associations, and we can't determine causality that way. Um, but like I'd say, I think it's bidirectional, and I would suspect that if you have a group that is using the internet to socially connect and you're reducing loneliness, you're going to see those physiologic changes. It would be interesting to correlate that. Thank you. Well, I think that's our time, so thank you.